Kustriana. In here, I'm gonna discuss about leukemia. Leukemia, or rather leukemia, is a blood cancer caused in the body, producing too many abnormal white blood cells. Leukemia can occur in both adults and children. White blood cells are part of the immune system produced in the bone marrow. When the function of the bone marrow is disturbed, the white blood cells needs to be done so that leukemia can be treated quickly. Next, characteristic and symptom of leukemia. At first, leukemia often causes no symptom. New symptoms appear when the cancer cells are getting more and begin to attack the body cell. Symptoms that appear also vary depending on the type of leukemia suffered. However, in general, the characteristics of people with leukemia are 1. Fever and chill. 2. The body feels tired and fatigued, does not move away even after resting. 3. Drastic weight loss. 4. Symptoms of anemia. 5. Red spot on the skin. 6. Nausea blood. 7. Body burns easily. 8. Excessive sweating, especially at night. 9. Easy to get infected. 10. A lump upright in the neck due to swallow lymph nodes. 12. Stomach feel uncomfortable due to swollen liver and spleen. More severe symptoms can be experienced by patients when cancer cells clog the blood vessels of the certain organ. Symptoms that might appear include 1. Great headache. 2. Nausea and vomiting. 3. Muscular out of control. 4. Bone pain. 5. Days. 6. Seizure. Okay, when should you go to the doctor? Immediately consult a doctor if symptoms appear, such as recurrent and prolonged fever or nausea blood. Symptoms of leukemia often resemble those of other infectious diseases, such as the flu. Examination needs to be done to detect early possible cancer and prevent the development of the disease. If you are an active smoker and feel it difficult to stop smoking, then consult with your doctor regarding the steps you can take to quit smoking. Smoking is one of the factors that can increase the risk of leukemia. Treatment of leukemia takes a long time. Regularly consult a doctor during treatment, even until the end of treatment. This is done so that the progress of the disease is always monitored by the doctor. Okay, next, cause leukemia. Leukemia is caused by abnormal white blood cells in the body and grow uncontrollably. The exact cause of the change that occur is not yet known, but the following factors increase the risks of developing leukemia. The risk factors in question include 1. Have a family member who has had leukemia. 2. Suffering from genetic disorders such as the Down syndrome. 3. Suffering from blood disorders such as myelodysplasia syndrome. 4. Have a smoking habit. 5. Have had cancer treatment with chemotherapy or radiotherapy. 6. Work in an environment that is exposed to chemicals such as benzene. Next, leukemia diagnosis. The doctor will ask about the symptoms experienced by the patient and perform a physical examination. Through a physical examination, doctor can detect signs of leukemia skin due to anemia, and swollen liver nodes, liver, and spleen. However, the diagnosis of leukemia cannot be confirmed only by physical examination. Therefore, the doctor will carry out further examination to confirm the diagnosis and the type of leukemia experienced by the patient. The types of inspection carried out include 1. Blood test. A complete blood count test is performed to determine the number of red blood cells, white blood cells, and platelets. Doctor can suspect a patient has leukemia if the number of red blood cells or platelet is low and the shape of the blood cell is abnormal. 2. Bone marrow aspiration. A bone marrow aspiration procedure is performed by taking a sample of bone marrow tissue from the hip bone using the long, thin needle. This sample is then examined in a laboratory to detect cancer cells. In addition to the diagnostic test upon, the doctor will also perform other follow-up examination to check for organ abnormalities due to leukemia. The types of the tests that can be performed are screening tests such as ultrasound, CT scan, and MRI, lumbar puncture, liver function test, and spleen biopsy. Leukemia treatment. Hematology oncology specialist blood and the cancer specialist will determine the type of the treatment carried out based on the type of leukemia and the patient overall condition. Here are some treatment methods to treat leukemia. 1. Chemotherapy, which is a method of treatment using drug to kill cancer cells. Drug can be in the form of oral tablet or intravenous injection. 2. Immunotherapy or immunotherapy, which is the administration of the drug that boosts the immune system and help the body fight cancer cells. The type of drug acid, for example, interferon. 3. Target therapy, which is the use of the drug to inhibit the production of the protein that the cancer cell has to grow. Example of the type of the drug that can be accepted are protein kinase inhibitor such as imatinib. 4. Radiotherapy, which is a method of treatment to destroy and stop the growth of the cancer cell by using heat power radiation ray. 5. Bone marrow transplantation, which is a procedure to replace damaged bone marrow in the healthy bone marrow. Sometimes surgery is also performed to remove the enlarged spleen or splenectomy. An enlarged spleen can worsen the symptom of leukemia experienced by sufferers. Leukemia complication. Leukemia can cause complication of treatment is not done immediately. Some of the complications that can occur are 1. Bleeding in organs, such as the brain or lung. 2. The body is susceptible of infection. 3. Risk of developing other types of blood cancer, such as lymphoma. 4. Complication can also occur due to treatment measures taken. The following are some of the complications of leukemia treatment. 1. Graft-versus-host disease, which is a complication of bone marrow transplantation. 2. Hemolytic anemia. 3. Tumor lysis syndrome. 4. Impaired kidney function. 5. Infertility. 6. Cancer cell reappear after the patient undergoes treatment. Children with leukemia are also at the risk for complication due to treatment. Because of complication that can also include central nervous system disorders, developmental disorders, disorder, and cataract. Next, leukemia prevention. There is not effective way to prevent leukemia today. However, there are several ways you can do to lower your risk of developing leukemia, including 1. Doing exercise regularly. 2. Stop smoking. 3. Ask personal protective equipment, especially if you work in an environment prone to exposure to chemicals such as benzene. 4. Conduct regular healthy checkups to detect cancer early, especially if you have